malnutrition predisposes children to illnesses, it really impairs their ability to fight infections. And so they become very sick often. And being very young, the risk for mortality is very elevated. And you find that children in these areas, just simply because they are hungry, they're less active, they're all often irritable or having signs of apathy. In the long term, we do know that malnutrition impairs their cognitive development, which means that they will possibly not perform that well in school. They'll probably not contribute adequately to the economy, which has far-reaching consequences for any country as it continues to grow economically and socially. Due to this kind of crisis, girls particularly are at a very high risk, especially where negative coping mechanisms are applied, like getting girls to go through the rite of passage earlier, like female genital mutilation to prepare them for marriage, which essentially provides the family with, some additional resources that they can then use to cushion themselves. And we do have instances where we have seen a rise in child labor, children dropping out of school to also go out and seek opportunities that would help their families to actually put food on the table. There's all the evidence now around what works for prevention, as well as really robust and at-scale programs on social behavior change communication and related strategies to improve caregiving behaviors and practices. One of the things was really to take a very strong approach to embed messaging in cash assistance programs. Households were visited regularly by the community health workers. They received a message around how to use the cash, why that cash was important, and how then using existing information, education, communication material around optimal feeding and care, it would be important then to diversify diets particularly. And so we did see very significant improvements in terms of the ability to procure nutritious diets based on what was available in the market. During COVID, there was also the growth of new strategies like using family network, where families actually are able to self-diagnose and do self-referral. We are still not out of the woods. Investing in early recovery is critical. Sustaining the treatment programs is important. Scaling up prevention is life-saving and is necessary. And so all partners need to come together to continue doing what we can until when government is fully able to take on all this programming, both for prevention and treatment, and really be able to sustain it in the long run.